The HIV/AIDS epidemic continues to cast a long shadow over global health, particularly impacting the most vulnerable among us children and adolescents. These young individuals, who should be enjoying the carefree days of their youth, are instead grappling with a life-altering condition that demands constant attention and care. These young lives, brimming with potential, face unique challenges posed by the virus. From the stigma associated with the disease, to the physical and emotional toll it takes, their journey is fraught with obstacles that many of us can scarcely imagine. Understanding the plight of children living with HIV/AIDS is crucial to fostering empathy, action, and ultimately, a future free from this devastating disease. It is not just about medical treatment, it is about providing a holistic support system that addresses their emotional, educational, and social needs. While significant progress has been made in combating HIV/AIDS, children remain disproportionately affected. They often lack access to the latest treatments and healthcare facilities, especially in developing regions where resources are scarce. They are not just passive victims. They bear the brunt of a disease that robs them of their childhood, their health, and often their future. The psychological impact is profound, affecting their self-esteem and their ability to form meaningful relationships. It is our collective responsibility to protect these young lives and ensure they have access to the care, support, and opportunities they deserve. This includes not only medical care but also educational programs and community support initiatives that can help them lead fulfilling lives. The statistics paint a stark picture. They highlight the urgent need for continued investment in research, healthcare infrastructure, and public awareness campaigns. According to UNICEF, 1.5 million children under 14 were living with HIV globally in 2022. This staggering number underscores the scale of the crisis and the need for a coordinated global response. These numbers represent not just data points but individual stories of struggle, resilience, and the urgent need for greater action. Each child's story is a testament to their strength and the importance of our support. We must remember that behind each statistic is a child, an individual with dreams, aspirations, and the right to a healthy and fulfilling life. They deserve the chance to grow, learn, and thrive without the shadow of HIV/AIDS looming over them. By understanding the challenges they face and the progress being made, we can work towards a future where no child has to face the burden of HIV/AIDS alone. Together, we can create a world where every child has the opportunity to live a life full of hope, health, and happiness. HIV, the virus that causes AIDS, attacks the body's immune system, leaving it vulnerable to infections and illnesses. Children are most commonly infected with HIV through mother-to-child transmission, also known as vertical transmission. This can occur during pregnancy, labor, delivery, or breastfeeding. Without any intervention, the risk of mother-to-child transmission ranges from 15 to 45%. This means that a significant proportion of infants born to HIV-positive mothers are at risk of contracting the virus. However, there is hope. Antiretroviral therapy, or RT, has emerged as a game-changer in preventing mother-to-child transmission. ART is a combination of medications that work by suppressing the virus's ability to replicate in the body. When taken consistently by HIV-positive pregnant women, RT can reduce the risk of mother-to-child transmission to less than 5%. This dramatic reduction highlights the transformative power of ART in protecting future generations from HIV. Despite the effectiveness of ART, challenges remain in ensuring its widespread availability and accessibility, particularly in resource-limited settings. Addressing these challenges is paramount to eliminating mother-to-child transmission and ensuring that all children have an equal chance at a healthy life. Children living with HIV/AIDS face a unique set of challenges that extend far beyond their physical health. These young individuals often have to navigate a complex web of medical, social, and emotional hurdles that can be overwhelming. These challenges are often interconnected and can have a profound impact on their overall well-being, development, and future prospects. The stigma associated with HIV/AIDS can lead to social isolation, making it difficult for these children to form friendships and support networks. One of the most significant hurdles is the late diagnosis of HIV in infants. Early detection is crucial for effective treatment, but many infants are diagnosed too late, which can severely impact their health outcomes. Delayed testing of infants born to HIV-positive mothers can lead to a rapid progression of the disease. This delay often occurs due to a lack of resources and awareness in many communities. This can result in severe health complications and even death, particularly before the age of 2. Early intervention is key to preventing these tragic outcomes. Furthermore, access to pediatric ART formulations remains limited in many parts of the world, particularly in low-resource settings. These medications are essential for managing HIV in children, yet they are often unavailable or too expensive. These formulations are specifically designed for children's developing bodies and are crucial for their growth and development. Without them, children are at a higher risk of developing severe health issues. Beyond the medical challenges, children living with HIV/AIDS often face immense stigma and discrimination. This social stigma can be as damaging as the disease itself, affecting their mental and emotional health. They may be ostracized by their communities, excluded from schools, and denied opportunities solely based on their HIV status. This exclusion can hinder their educational and social development. This can lead to social isolation, psychological distress, and a diminished sense of self-worth. The emotional toll can be long-lasting, affecting their ability to lead fulfilling lives. As these children transition into adolescence, they encounter additional challenges related to treatment adherence, mental health, and risky sexual behaviors. Adolescence is a critical period, and managing HIV during this time requires comprehensive support. These factors can increase their vulnerability to transmitting or acquiring HIV, further perpetuating the cycle of the epidemic. Addressing these issues requires a multifaceted approach, including education, healthcare, and community support. Early diagnosis of HIV in infants is crucial for preventing illness and death. Detecting the virus at an early stage allows healthcare providers to intervene promptly, offering the best possible care to the newborns. When a baby is diagnosed early, they can start treatment immediately, which significantly improves their chances of survival and living a long, healthy life. Early treatment can prevent the virus from causing severe damage to the infant's developing immune system. Early infant diagnosis programs are essential for achieving this goal. These programs are designed to identify HIV-positive infants as soon as possible, ensuring they receive the necessary medical attention without delay. These programs involve testing infants born to HIV-positive mothers within the first few weeks of life. The tests are usually conducted using blood samples, which are then analyzed for the presence of the virus. This early testing allows for timely initiation of ART, which can dramatically reduce the risk of infant mortality and improve long-term health outcomes. Antiretroviral therapy helps to control the virus, allowing the child to grow and develop normally. However, access to early infant diagnosis services remains a challenge in many parts of the world, particularly in sub-Saharan Africa, where the burden of HIV is highest. In these regions, healthcare infrastructure is often limited, making it difficult to reach all infants in need. Barriers to early infant diagnosis include limited access to healthcare facilities, which can be located far from where families live, making it hard for them to travel for testing. Lack of awareness about the importance of early testing is another significant barrier. Many parents may not understand the critical need for early diagnosis and treatment, and stigma associated with HIV can prevent families from seeking the necessary care. Fear of discrimination and social ostracism often discourages parents from getting their infants tested. To overcome these barriers, it is crucial to strengthen healthcare systems, ensuring that facilities are well-equipped and accessible to all. Training healthcare workers on early infant diagnosis protocols is essential. Well-trained staff can provide accurate testing and compassionate care, encouraging more families to participate in these programs. Raising awareness among communities about the importance of early testing is also vital. Public health campaigns and community outreach can educate parents about the benefits of early diagnosis and treatment. Mobile testing units and community-based testing initiatives can also play a vital role in reaching infants in remote areas. These services bring healthcare directly to the families, overcoming geographical barriers. By prioritizing early infant diagnosis and ensuring timely access to treatment, we can give infants living with HIV the best possible start in life and protect them from the devastating consequences of late diagnosis. Every child deserves a healthy future, and early intervention is key to making that a reality. In the face of adversity, hope shines through. For children and adolescents living with HIV, access to treatment and support can be a lifeline. It's not just about medication, It's about comprehensive care that includes emotional and social support. By addressing these needs, we can help young lives not only survive but thrive. The journey is challenging, but with the right resources and community, a brighter future is within reach. Stigma and discrimination remain significant barriers for children and adolescents living with HIV. It's crucial to foster environments where they feel safe and supported. By educating communities and promoting empathy, we can combat the harmful stereotypes and prejudices that these young individuals face every day. Everyone deserves to live free from fear and judgment. Education and support play pivotal roles in the lives of children and adolescents with HIV. Through comprehensive sexual education, we can equip young people with the knowledge they need to protect themselves and others. Support systems, including counseling and peer groups, provide the emotional and psychological assistance necessary for them to thrive. Together, education and support create a foundation for healthier futures. Over the years, significant progress has been made in the fight against HIV. Advances in medical treatments have transformed what was once a fatal diagnosis into a manageable condition. There is hope on the horizon, with ongoing research bringing us closer to a cure. The resilience and strength of young people living with HIV inspire us to continue pushing forward. Addressing HIV in children and adolescents is a collective responsibility. Governments, communities, healthcare providers, and individuals all have roles to play. By working together, we can ensure that every young person living with HIV has the opportunity to lead a healthy and fulfilling life. It's up to all of us to create a world where HIV is no longer a barrier to achieving one's dreams.